Hi guys, it's good to see you again. We're back again for our usual Instagram live session every Sunday at 5 p.m. and now is the time for another one. I remain your humble host, Fonobong Etokwan, and I'm representing First MedTrade on this Instagram live session. And it's good to have you again. Today we're going to be talking about plastic surgery. I'm sure if you've seen our poster, you already know our topic for today, and we're having a guest doctor who is a US plastic surgeon, Dr. Emeka, who will be speaking to us on this topic, and we're super excited about it. And we're waiting for you to join us, and we're also going to have Dr. Emeka join us soon. But before we go into our topic of today, of course, I would like to remind you again of what First MedTrade is and what we do. First MedTrade is your one-stop medical company that brings you healthcare, quality, affordable, and accessible healthcare directly to your doorstep at the convenience of your home. Using our platform by visiting our website at www.firstmedtrade.com, you can have access to doctors, have access to hospitals, buy your medical consumables, book for your medical travels, for ground ambulances and air ambulances. You can book that on our platform. And also, you follow us on Instagram and all other social media pages. We have amazing content for you that's going to help you with your health and your daily lives at First MedTrade. That is what we do, and I mean, we're always excited to make sure that you get accessible, quality, and affordable healthcare at any particular time of the day. So tell your family, tell your friends about us. That is who we are. So today, as I mentioned earlier, we'll be talking about plastic surgery, the myths versus the fact. I mean, if you're considering plastic surgery any moment from now, or maybe at the end of this live session, or you have considered having any cosmetic surgery at all, this is the right platform, and now is the time for you to come in and send in all of your questions. Every question that you have about plastic surgery or cosmetic surgery. Do you want to have a butt implant? Do you want to have a breast implant? Do you want reduction? Do you want a liposuction? Any of it at all. This platform right here and this live session right here is the great opportunity for you to ask your questions, give your comments, clear your doubts, know the myths versus the fact about this surgery. Because today we're having our guest doctor, Dr. Emeka, who is a US-based plastic surgeon, who is going to be our guest here to tell us about plastic surgery, the myths versus the fact, and answer your questions, as many as possible in the short time that we have to be with you. So we're going to be adding Dr. Emeka here very soon to join us now, and we're going to continue this live session in just a moment, and we're going to have Dr. Emeka join us for today's live session. I'm trying to get connection with Dr. Emeka right now to join us for this live session. So that's what I'm trying to do now. I'm yet to see his request, but I'm sure he'll be joining us soon. So while waiting for Dr. Emeka's request to join our live session, I would personally like to briefly go through our content for the week concerning plastic surgery. I mean, we had amazing content for the week where we talked about the myths versus the fact about plastic surgery. And the first off on our list was the fact that people think that plastic surgery is for women only. You know, oftentimes when people see women on Instagram, Twitter, and all other social media platforms with well-curved bodies, maybe people they knew before today didn't really have that much of big breasts, but after some time, they notice that their breasts have become bigger, or their butts or their hips have become bigger, their waist slimmer, and their stomach flatter. People often call out this woman, this woman did cosmetic surgery, she has done surgery, you know, and the news is everywhere. Everybody's the woman, and it now looks like it's only the women that actually undergo any form of cosmetic surgery to fix any part of their body. But you know, the thing is, there are men who also take time out, you know, go to the hospital, book appointments with doctors to get surgeries done. I mean, plastic surgeries. There are men that get this appointment to fix something, maybe their cheekbone or their hair, something. I mean, so it's the fact is, plastic surgery is not only for women. There are men too who also are involved in doing these surgeries to fix certain parts of their body that they are not satisfied with. Another myth there that we had during our content of the week was the fact that people usually think that breast implant increases your risk of breast cancer. You know, according to the research that we did and the content that we put out there, it has not been established by any medical personnel. It has not been established really if plastic surgery actually causes or increases the risk of one having breast cancer or any other disease. So it will be wrong for you to assume that once somebody does breast implant, the person may actually end up having breast cancer. It will be wrong for you to assume that. Another thing that we'd like to address as a myth is the result of plastic surgery. They usually last forever. Okay, now this is another thing. People often ask these questions. If I get my body done, how long is it going to last? How many years am I going to carry this super hot body? I mean, people forget that you're not fixing your body doesn't mean that you're going to hold the time. I mean, you're going to make the world stop, so your body is going to look that way for the rest of your life. I mean, life keeps evolving, your body keeps changing. As you're aging, your body is aging. But this doesn't mean that you can't always go back and get the surgery to continue fixing that body. Yeah, you can always go back to fix the body as often as you want to make sure it stays the way you want it to stay. But the thing is, the plastic surgery does not prevent your body from aging. Even after the procedure, it doesn't stop your body from changing even after the procedure. That's one thing we want our audiences to know today about plastic surgery. Okay, Dr. Emeka will be joining us very soon. Very soon he has sent a message that he's going to be connecting with us very soon. So we're going to wait for his request. We're already sending him ours now to connect with us now. So please hang in there with us as Dr. Emeka will connect with us very soon. Also, another thing that we put out there as our content for this week that we're talking about plastic surgery is the fact that people think that cosmetic surgery is the same as plastic surgery. Well, the field of plastic surgery includes cosmetic surgery, but they are not the same thing. Plastic surgery could include reconstructive surgeries. Cosmetic surgery is only about making you look better, which is what is very common that we know about. But I mean, in other parts of the world, aside from Nigeria, there are people that are undergoing reconstructive surgeries every time to fix one particular part of their body or the other that probably had issues, maybe as a result of a major accident or something happened. So this is happening this is happening very often in other parts of the country. So this is us saying that don't mix the two of them up. I mean, know the difference of what you're trying to do. We're still trying to connect with Dr. Emeka. He's going to be joining us very soon to take over from me, of course, and give us even more details on this particular topic. So, and don't forget, yes, okay, Dr. Emeka is here and he's joining us in, okay, we're waiting to connect to him. Okay, I think we'll have some problems with the connection, but it's coming up very soon. I'm sure he's going to be joining us any moment from now. So, I mean, if you have any questions, any comments, if there is anything bothering you concerning this topic, it's best you send in your questions or your comments now. We'll be looking at it via DM or of course, via the comment section that is scrolling up the screen. The doctor is going to see it and go to reply to you as much as possible. You know, we don't have all the time during these live sessions to talk about everything, but we try as much as possible to make sure that we exhaust as many questions as possible. And of course, you know, we already have people that sent in questions before the live sessions today. So we're also going to try to address those questions while addressing yours too. Okay. There is some issues with the internet, but we're still waiting to connect with Dr. Emeka to take us on this topic. So hang in there with us, don't go anywhere. Okay, he's here.
Good morning. Sorry, I'm not tech savvy, so I had to play around with the thing a little bit.
Oh, okay, that's totally fine. Thank you so much for connecting with us. We've been waiting for you. My name is Mfono Bong. I'm representing First MedTrade on this live session today. Dr. Emeka, welcome. Thank you so much.
Thank you for having me.
Okay, so we'll just get right into it since we don't have a lot of time. We're talking about plastic surgery this week on our platform, and you know, people have lots of questions about plastic surgery. People, you know, in recent times the world is evolving, and people are buying the idea of, you know, fixing one part of their body or the other, trying to make changes and get this perfect shape. So first of all, we wanted to debunk some of the myths that around plastic surgery, and then also take people's questions, that things they worry about, for people that are considering plastic surgery. We also want to take questions about things that are bothering them. So those are the things we're going to be talking about today, Dr. Emeka. Thank you so much for finding out time to be with us on this session. We really appreciate you. Thank you.
It's not a problem. Although I must correct one first myth, even in your statement. People have been getting cosmetic surgery for decades. I think the difference now is that people are not as secretive and as shy about it. But if you look at the numbers of cosmetic procedures around the world over the last decade, the number has been pretty steady. The types of procedures have changed as, you know, people want bigger butts or bigger breasts, depending on what the trend is. But people have been getting surgery done. Just that people didn't talk about it before. And I think now the newer generations are more comfortable talking about it and sharing the fact that they had work done with other people.
Okay, thank you for that. Yeah, so just before you joined us, what I was trying to talk about the first myth that people usually think that plastic surgery is mostly for women, because I don't know, somehow it's very obvious that women you know, get their body done. So it almost seems like there are no men that actually book appointments with doctors to fix one part of the body or the other. So that's the first thing we're trying to debunk. What is the number, or should I say the ratio, of men to women that actually do cosmetic surgery?
All right, well, I'm glad you said cosmetic, because plastic surgery really has two divisions. You have the reconstructive, which is cancer, burns, accidents, and things like that. And then you have cosmetic, which is surgery on people who are not necessarily ill or sick, but just want an improvement. Men get cosmetic surgery done. Clearly, the ratio is I would say about 90% to 10%. So there's still, majority are still women, but there are a lot of men that get work done. And part of the reason is that obviously there's a lot of pressure on women in the media and you know, on TV and everything to look a certain way. But I think the other thing is that with pregnancy and delivering babies and aging, there are a lot more changes that happen in the female body, and so there are more things to change. As men, obviously don't carry babies, don't get pregnant, don't have breasts and things like that. So, well, they shouldn't have breasts. Sometimes they do, but there are just more things that you can change, I think, on a female body than on a male body.
Okay, yeah, that's true. Okay, we'll go right next into it. The second thing is for women that get breast implants, people who have no good knowledge of this procedures usually assume that, you know, just by making mere statements, and before you know it, people take it and tend to believe it as fact that once you get a breast implant, the chances that you're going to get breast cancer is very high. People tend to say that, and maybe to scare people, or maybe because of what they believe. So want to know, is that really true? Like, is there any truth or sense in that?
No, so absolutely no correlation between breast implants and cancer, period. I could say that unequivocally, 100% none. Now, breast implants came on the market in the 70s, actually. And then there was a time for 10 years they were taken off the market. The silicone implants were taken off because there was a question of whether they were linked to certain disease. And the disease was actually a certain type of arthritis, so pain in the joints. It had nothing to do with cancer. Even then, these implants were taken off the market. They were restudied. They looked at the population, and after 10 years of research, they showed that there's no correlation between the implants and this arthritis disease that people were looking at, and they brought them back onto the market. They just studied it for 10 years before they brought them back. So as of now in 2020, there's absolutely no correlation between breast implants and any type of disease, whether it's arthritis, rheumatoid, cancer. There's no correlation at all. The only thing I must caution is that breast cancer is very common. It's 1 in 9 women will get breast cancer. So that's very common. And so it's important to get your mammograms after the age of 35 and do your screening, because it's a very common disease. And if you have implants, you have to let them know that you have implants, because the technique for doing the mammogram is a little bit different. They have to move the implants out of the way to look at your normal breast by mammogram. So that's the only sort of caveat when it comes to breast implants, but there's no correlation between breast implants and cancer at all.
Okay, thank you for stating that and making it very clear. Okay, just before I go to the next question, that I already have someone in the comment section here is asking, how long does it take for scarring from cosmetic surgery to disappear?
Okay, so scars, when you cut the body and the skin and you sew it back and it forms a scar, the scar is permanent. Scars do not disappear. Let's just start with that. Now, they're going to look red or brown and raised and angry in the beginning, and over months, the body will what they call remodel. It will remodel the scar. It will eat away some of the scar after it's healed. That's normal scarring. And that's why you see scars that are 6, 7 years old tend to fade and look a little difficult to see sometimes, when they've healed properly, but they never disappear completely. Now, if you have the gene that forms keloids, and keloids, I'm sure, is what people are worried about, the thick raised scars. Those are people whose body doesn't have the signal to start remodeling, to start eating away the scar. They just don't. They're born without that signal, so they keep making scar until the body just stops. So those people form keloids. Those keloids are very difficult to treat, and that's a discussion for another day. But normal scarring fades over time. It takes about 6 months to a year to fade, and it continues to fade but never disappears completely. And that's why when we're doing cosmetic surgery, we try to hide the scars in areas where they're not very visible, knowing that they're permanent and they will be there. But if we can put them in a skin fold or hide it underneath the breast or in the armpit or somewhere where nobody's really looking, then it doesn't really matter because the scars are permanent.
Okay, thank you for the Amina. I hope your question has been answered. The scars don't really go away, but then doctors find a way to make sure that it's somewhere where it's not really obvious. Okay, back to the next question. A lot of women have asked this question. People sent this question in before today about doing cosmetic surgery. I mean, women are asking if I get a cosmetic surgery done today, what are the chances that it's going to stay there forever? I mean, as I'm getting older, does my body shrink? Or if I'm eating carbs, I actually took fat out of my stomach. The carbs make my stomach bigger and all that. So, what can you tell us about this?
I think my answer is, sorry, is that the? Should I go? Okay.
Yes, go on.
Okay, so cosmetic changes will follow your body's normal aging. Okay, so for instance, if you want to put fat in your cheeks to raise your cheeks, as you age, the fat will drop. That's a normal aging process. So your body will age normally regardless of what cosmetic procedure you get done. But that's aging. So aging just means loss of fat, fat dropping, gravity pulling things down. Something like a breast implant, for instance, is not fat. It's a silicone ball, basically, that they put in. That will stay wherever you put it forever. It doesn't move. It's not subject to normal aging process because it's not part of your normal body. So it depends. Now, if you get, let's say, liposuction and your belly is flat, and you're asking me, well, will my belly be flat forever? The answer is it depends. I know I'm kind of squirming around, but if you don't gain weight, your belly will be flat forever. If you stay the same weight, or if you stay within, let's say, 4 or 5 pounds of your weight at the time of surgery, your belly will be flat forever. You're not going to grow more fat. You're not going to make more fat cells. Your body cannot actually make any new fat cells once they're removed. But if you continue to gain weight, then your body will store that fat somewhere. Even if it doesn't store it in the belly, it will store it somewhere else, and it may store it someplace that you're not happy with. So really, even though you get cosmetic surgery, you have to maintain it. You have to watch what you eat. You have to exercise. You have to do certain things to sort of keep a balance. And I'm not saying that you have to run marathons or become the next, Power Mike, but you need to do some things to maintain your caloric intake and your versus what you burn in order to maintain your weight, and your results will last.
Okay, that's fair. But then, of course, the doctor just said as you age, it definitely ages. The surgery actually goes on to age together. Okay, Amina here is asking another question. Is it normal to feel pains months after the surgery has been done?
No. Simple answer, no. Even the most complex reconstructive surgery we do, let's say a tummy tuck, where we're fixing muscle and we're changing fat and skin, and patients typically take pain medicine for 3 or 4 days, not even weeks, days. And even the people who are the most sensitive to pain are off pain medicines in a week. I don't really know anybody that's still taking pain medicine a week after any procedure that we do. If you have pain months after, there's something else going on that needs to be explored. And that's not part of normal healing.
Okay, thank you so much. Then there was someone sent in this question. Apparently it looks like it was a teenager. She was asking, at what age can someone actually do a cosmetic surgery? Is there any age number? Like, is there any age number that one should consider before getting a cosmetic surgery?
That's actually an excellent question. I think the short answer is at the age of legal consent. So if it's in America, for instance, I think legal consent is at 18. It's not a random number. It's usually an age at which somebody can really digest the information and give the consent for the surgery. So for instance, I've done a breast reduction, let's say, in a woman who was 16 because the breast was so heavy she couldn't, she had trouble walking, her posture, back pain, all these kind of things. Yeah. But I don't think a 16-year-old can grasp exactly the complexity of having surgery, permanent scarring, pain, rehabilitation, a bunch of things. And so I generally would not operate on someone below 18, or even somebody over 18 if I feel they don't really understand what they're getting into. They don't really understand the complexity and the gravity of what they're getting done. But most surgeons would use 18 as a general guide to when you can start getting surgery. The other thing is that you don't want a young woman of 18 to get the impression that she's flawed. I mean, that's a very young, tender age when you're still building your self-confidence and your self-esteem. So to now feel that you need to fix things on your body at 18 in order to feel confident or feel good about yourself is probably a very dangerous precedent to start on someone. You know what I mean? So I also shy away if I think that somebody is doing it because there are other issues that they should be addressing, not their body, but either self-esteem issues or psych issues or depression or something else that they really should address. And the changing your body is not really the answer.
Okay, thank you very much. I hope she was here to hear that there's so many things you have to consider as soon as a teenager to even think of adjusting certain parts of your body. Okay, so back to this. people also ask, is there any particular behavior one should stop before if someone is considering, you know, actually having a cosmetic surgery? Maybe probably if you're smoking, drinking excessively, are there certain behaviors and attitudes one needs to stop or completely, or maybe bring to a minimum before undergoing cosmetic surgery?
Well, you shouldn't be smoking and drinking excessively anyway, right? I mean, that's bad behavior to begin with. But as pertains to surgery, I get your question. Smoking is an absolute no-no. You can't smoke a month before surgery. You can't smoke during your recovery period. When you smoke, your blood vessels shrink. So if your normal blood vessel is this size, smoking can actually shrink it over 50, 60%. And you need blood circulating to heal areas that are cut. So we have an absolute cutoff of 1 month before any cosmetic procedure that you have to stop smoking, and you can't smoke while you're recovering. Now, once you've recovered, I encourage you, if you've gone that far, not to smoke again, but at least you've recovered, then it's safe. Drinking really doesn't affect healing. We stop people drinking 48 hours before surgery because we don't want the alcohol to interact with some of the drugs we use during surgery. But in terms of healing, long-term, drinking doesn't really affect it unless you're just an abusive drinker and your liver is bad. You know, drinking damages your liver, and people with bad livers tend to bleed more during surgery. So we'll watch out for that. If you're planning to have a baby within the next year, then you really don't want to do procedures on your belly because pregnancy can reverse those changes that you just spent all your money, you know, getting. So that's another thing I watch out for. If you just had a baby, you need to wait 6 months before you get a procedure. When you're pregnant, your blood circulation doubles. And so if you have surgery too soon after delivery, you'll bleed a lot also. So there are certain things that we look at. One other thing I must mention, even though it's sort of related to the question, is 90% of the problems people have during surgery can be prevented by working them up before surgery. They're really related to before surgery. For instance, if I don't find out that you're a smoker and stop you, and then you have surgery and have a problem, that's something that could have been avoided. So 90% of surgical complications can be avoided just by taking the steps before surgery, not during. Most of us during surgery, we've been doing this for a long time. During surgery, you know, we know what we're doing. It's the stuff that you need to do before surgery that's important.
Okay. Okay, well, people also ask this question very often. Worst case scenario, what are the major risks one could encounter, one could have while after undergoing cosmetic surgery? Like, what are the look here. Amina is asking the question here: are there higher risk of complications with cosmetic surgery as women age? Just where I was headed for.
Yeah, so I think it's a very specific question. So each procedure has its own risks. But in general, the risks of cosmetic surgery are very minimal. Remember, these are people that are not sick, they're not ill, they're not bleeding, they're not in pain, they don't have a problem they're trying to solve. You're trying to make a body part better. So the risk of dying or just permanent deformity and all these weird things that people talk about are almost non-existent. Now, age itself is not a deterrent to surgery. Obviously, the older you are, the more problems you develop with your body. Therefore, we tend to do these cosmetic surgery in older people, not younger people. What's important is not your chronological age, it's your medical age. So for instance, if somebody is 40, is a smoker, has high blood pressure, has diabetes, they're much worse, higher risk at 40 than somebody who's 70, who's on no medication, no high blood pressure, nothing. I would rather, not what I'd rather, but it would be a less risk for the 70-year-old than for the 40-year-old. So your medical age and your comorbid factors are what are important in determining your risk for having surgery.
Okay, I hope your question has been answered. So we don't have to go back there. I was just going to ask the same question. What are the general risks involved, which you obviously already answered. So lastly, I would like you to tell us, somebody asked the question, first of all, is plastic surgery outpatient or inpatient, and how does one prepare for this surgery? Because it looks like I've had a lot of people asking these questions who have interest in undergoing cosmetic surgery anytime soon. I think these are the last two questions we're going to be taking today.
Sure. Okay. So most of what we do, I mean, literally 95% of what we do can be done as an outpatient. You can get the procedure done and you can go straight home right after surgery. There are a few exceptions, and that's probably that 5%. If you're doing multiple areas, so for instance, there's something we call a mommy makeover, where all the changes that occur from pregnancy we reverse, right? So the breasts, they drop or they get deflated, we lift them. The belly skin is stretched, we do a tummy tuck. Sometimes we do some liposuction. So we do a bunch of different things. Those patients may spend one night with us and then go home because we're doing multiple procedures. But everything else we do essentially, whether it's a nose job or breast work or belly, tummy tuck, liposuction, all those things can be done, and you can go home the same day right after surgery and just follow up in a few days with us in the clinic. There are some patients who are higher risk. So for instance, if somebody has diabetes, but we're going to operate on them anyway, I might keep them overnight and watch them, make sure the sugar is in control before I let them go home. Or if I feel like somebody doesn't have somebody at home to watch them for the first 24 hours as they're recovering from anesthesia, then we might keep them overnight, let the drugs get out of their system, and then let them go the next day. But really, I mean, I can't really think of any cosmetic thing we do that requires you stay in the hospital, at least in 2020. 20 years ago, we were keeping everybody for 3 days. But now we found that it's really not necessary. People do better when they're at home than when they're in the hospital.
Okay, thank you so much, Dr. Emeka. It was so good to have you talk to us on this particular topic, and you have touched all the questions that we had for today. And I'm sure our audiences and our followers are very clear on these things. And yes, for those that are interested in doing plastic surgery or cosmetic surgery, any one of them, I'm sure they fully understand that some of the myths that they're used to are actually not true, and they should debunk them and stick to the fact. It was so good to have you talk to us. Thank you so much for honoring our request. Thank you.
You're welcome. It's a pleasure being with you. You guys have a great rest of your weekend.
You too. Thank you so much. Okay, guys. I mean, it was a really, really amazing session there, and I learned so much. To think that I used to believe some of those myths now, and hearing from a professional, Dr. Emeka, who is a plastic surgeon in the US, clearing all those myths and telling us exactly what are facts makes me feel really confident on the things that I know. And I hope you also learned a lot from that session, because I mean, if you're considering plastic surgery today, of course, you've heard that the risks are very minimal, except for those that have underlying health issues that the doctors need to check. And so you can always go ahead, because the risks are not as high as, or how do I put them? They're not as bad as we usually think in our heads, you know, and the way we have exaggerated them and formed some theories about it, and then, you know, fed this to even the people around us and stop people from doing what they actually really love and what they would actually really, really want to do. So I'm sure you also enjoyed that session. And next week we'll be coming back again with an amazing topic, and we hope to have you here. Then again, it doesn't stop you that if you have any questions or any comment again that you want us to address that we have not addressed on this session today, feel free to send in your questions. We're going to make sure you get a response as soon as we can and clear your doubts on whatever issues that you have. Thank you so much for joining us. I'm still Mfonobo, and I'm representing First MedTrade again. First MedTrade is your one-stop medical company that allows you to have access to affordable and quality healthcare right at the comfort of your home. So on our platform, if you visit our website today at www.firstmedtrade.com, you can find doctors, you can find hospitals, you can buy your medical consumables, you can book for your ground and air ambulances, patient referrals, and co. And as a doctor, you can also sign up on our website today as a physician on our website. and get access to patients all over the world. It was good to have you today, and I'm super excited that you guys came around today to join our live session. Thank you so much, and see you next week again when we'll be having another interesting topic to talk about and another amazing doctor to take us on that topic. But for now, I'm leaving you. Thank you. Thank you for speaking with us. Thank you so much. We appreciate you. Have a wonderful week ahead. Bye. Okay.